Hi, I'm Dr. Kivett from Santa Rosa, California. I'm a board-certified plastic surgeon and dermatologist with additional training of a fellowship level in hand surgery, that is to say, surgery of the hand and the forearm, which comprises a significant part of training in the field of reconstructive plastic surgery, in which I specialize. I'd like to speak today about infections of the hand, infections of an acute nature. We'll talk in another video about infections of a chronic nature. However, the infections of an acute nature really shouldn't be underestimated in their power to injure a person and change the course of their life. Infections of the hand can result in significant disability and much worse. Infections come about as a variety of germs will infiltrate the tissues, germs of a wide variety of types, and the host, namely the person themselves, plays a big part in this. If a person has a damaged immune system, for example, they have diabetes, even diabetes under control, much less not under control. There are other forms of immunosuppression as well. Some of them are brought about by doctors treating patients for a variety of conditions. People who have arthritis sometimes will be either on chronic cortisone medicines to help that. There are a number of newer drugs out now called biologics, which attack very specific areas of what's called the interleukin system, which is a real breakdown. It's been studied very sophisticatedly over time. And so these biologics are directed at very specific subtypes of diseases, whether it's inflammatory diseases of joints or of various body parts or of skin. It's quite a separate art. And so immunosuppression can give rise to that. As you listen to the ads that appear on late night TV, you'll see that they'll talk about how people can get various infections in various parts of the body, and in fact, that will potentially have an impact in the issue of hand infections. Some patients have transplants of kidneys or hearts, and so again, to prevent rejection of that new organ, they'll be immunosuppressed as well. There's some more subtle things that are associated with immunosuppression as well, and that is a high sugar diet can produce a great deal of insulin, and insulin is very inflammatory, and that damages your immune system as well. Foods that contain a lot of starch produce inflammation, and you don't need foods that produce a lot of sugar for you because your liver has a collection of fat, and it knows precisely how much sugar to break your fat in your liver down to give you power for muscles and brain. A number of germs live on the skin of normal people generally, and that collection of germs is beneficial to maintaining the quality of the skin. However, if the skin in any way is disrupted by anything, even a simple scratch or a scrape, much less something like a cut while people are trying to open a can of beans or something, then that collection of skin bacteria, funguses, and yeasts can get down into the skin, set up housekeeping, and give acute infections of the hand. Acute means sudden and needing rapid treatment as opposed to chronic infections, which is a different category. Infections that get into the deeper tissues cause a problem called cellulitis, and so the most common germs that get into the area of the hand and arm are staph and strep and MRSA, methicillin-resistant Staph aureus. Staph generally is not necessarily a bad germ, but subgroups of the staph can cause a problem. There's a lot of staph in dogs' mouths, and so even a little brush against the skin of a dog's mouth, giving an abrasion, can give you a problem. Strep is also a common problem. We should talk a little bit more about MRSA, or methicillin-resistant Staph aureus. It used to be seen in people who were hospitalized and quite ill, and it was considered to be very much a problem and not very common. And now methicillin-resistant Staph aureus is present in the population of the community in general. If cellulitis is allowed to proceed, then tissue can actually lose the oxygen going to it and can result in what's called necrotizing fasciitis. Necrotizing meaning dealing with the death of small areas of tissue, and fasciitis means intense inflammation, if not outright infection, of the fascia, that is to say, the thick, gristly lining over the outside of a muscle. The hand has a number of muscles, and this can be a real problem. It's important to differentiate, is this truly an infection? That is to say, the redness, the swelling, or is it actually just purely an inflammation, such as when a person has deposits of crystals of oxalate, for example, and calcium that you would see in gout, which comes from eating shellfish and other foods that are high in a variety of chemical substances, such as oxalates. Or is it truly an infection? Or is it an inflammation of another structure, the tendon, for example, as in pseudogout, where there's calcium that develops along the tracks of tendons. People have to realize that the hand is really a mini organism in itself. So in dealing with the hand, one goes all the way from the skin to talk about tendons, joints, nerves, vessels, bone. There's a number of structures within that little structure that we use to make our lives good. And so it's really important to realize that. Paronychia is a term that's used, and it's seen in people whose hands get wet a lot, babies who suck their thumbs, waitresses who have wet rags they're continuously wiping a tabletop. And paronychia refers to the fact that there is a space where the nail supposedly starts, but people don't realize that the nail actually starts even before where they see the nail. In other words, a good 1/8 of an inch or 4 millimeters up into the finger. The cells, which are part of what's called the nail matrix, form nail tissue there, and as the nail moves out, it encounters the air and gets hard, and that's what we call a nail. But if you look at the nail, you'll see like a little white half moon, and that's where the what's called the germinative matrix, the growing tissue of the nail, continue to turn over and grow and produce nail. And so this area can become infected, the space where the skin meets the nail. There's a tendency in beauty parlors and nail specialists for cosmetic reasons to try to push back what they call the cuticle. And in pushing it back, somehow it lends a cosmetic value to the nail. But in fact, where the nail exits from the skin is a delicate area, and so it should stay sealed and not pushed back. Because if it's pushed back, then that creates a potential space, although very, very narrow, where water and other elements, chemicals and bacteria and funguses and yeasts and all kinds of other things can get up underneath there. And when they grow, then that part of the skin next to the nail turns pink and swells and hurts. And if there's enough of an infection there, then it can spread in the tip part of the finger further down. And you'll see that there are small septi, or small little tiny walls that attach the skin to the bone, and those little walls hold the skin so that if a mountain climber grabs on with his fingers onto a rock, he doesn't pull the skin away from the bone. The skin stays stuck to the bone. Well, those little septi will allow bacteria to get into each of those little compartments. And so that's where you can get an abscess, which is called a felon, actually, F-E-L-O-N. And so sometimes that needs to be quickly emptied out by small incisions. And the finger, of course, can be numbed, because there are easy ways that are almost perfectly painless to numb a finger further up without getting shots in the finger. And so that's important. Some people will try to avoid seeing a doctor because of fears of being tortured by anesthesia when they don't need to have that. If infection gets into the tendon, which inserts into the base of the finger, either on this side or on this side, then the infection can move up through a space that surrounds the tendon, and that's called tenosynovitis. That is, teno meaning tendon, synovitis means inflammation, inflammation of the lining tissue that's around the tendon that allows it to glide. And so that can be kind of like a little pipeline much further up into the hand. The condition is called tenosynovitis. Dr. Kanavel, K-A-N-A-V-E-L, described signs when that was happening. So if a person ends up where the finger is flexed a bit and they really can't move it, and it's swollen all the way up the finger, and there's tenderness along where the flexion part of the finger pulls down, and then anytime anybody examining the finger tries to even just push the finger upward, it's the worst pain a person's ever felt. They scream in pain. Then those are called Kanavel signs, and that's the sign of infection in the flexor tendon sheath. It needs to be dealt with by being drained in an operating room situation. Deep space infections can take place too, because in between the muscle bundles of the hand, both further out where the thumb is, as well as deep in the hand, those are called deep space infections, and those need to be addressed immediately so that the tissues don't die and get the infection in further up. So you can get infections in the joints that need to be dealt with by trying to aspirate or pull with a small needle pus out of the joint to test it. Sometimes those need to be opened. There's animal bites, like cat bites, that produce Pasteurella bacteria, as well as staph and strep. Human bites also have a number of bad organisms. And in the particular situation where two people are fighting and a clenched fist strikes somebody in the mouth, and a tooth that has germs on it will get into the tendon sheath, then as the person straightens their fingers out, then that infection is carried backwards. So even though the cut is up further, the infection is carried upwards, and that needs to be opened immediately. There are intravenous drug abusers also that have limited hygiene, and so multiple uses of needles or not prepping the area correctly with soap or other chemicals will lead to infections that can easily get into the veins of the hand. There's a condition called herpetic whitlow. Herpes is the germ. It's very common in lots of people. And whitlow is seen where somebody is examining a patient, say dentists see this a lot if they're not wearing gloves, or babies sucking their hand and their fingers while they have herpes of the mouth will get those, and they need virus treatment, both topical and systemic. The endpoint of infections is gangrene, and so where there's a great deal of infection, those wounds have to be opened completely and quickly. Besides the gout that I mentioned earlier with the crystals that mimic infection and the tendinitis that I mentioned, there's also other conditions like pyogenic granuloma, it's called. And this is simply just small areas of blood vessels growing in the tissues growing outward, and people think it's an abscess, when it's simply just a minimally important area of blood vessel growth. The final one to talk about is the injection injuries, where people who work in situations where they're spraying paint under high pressure or squirting oil and they happen to hit their fingertip with the tip of that, the high pressure injections can easily go right up the sheath around the flexor tendon on the palm side of the hand and frequently get up into the arm, and that whole area needs to be opened up to prevent infection and to prevent damage to all kinds of structures and ultimate disability. So if there's any question in your future about any of these things, please be sure to consult with your physician immediately so that something can be done with it, and it'll save you a problem with disability, chronic stiffness, pain, weakness, inability to do your job, play a musical instrument, and so forth. If you found that this video has been helpful, please give us a thumbs up. Please Tell your friends to enjoy it. Give us a like and maybe even subscribe so that we can continue to provide more information for you. And thank you very much.